There's a whole lot of you that wanted to come today, so welcome to everyone who's joining us. My name is Chris Billhart, and I work with the National Alliance for Safe Housing. We're a technical assistance provider, and we're part of a consortium of TA providers who are really trying to hear what's going on in the field and respond to it with what information we can bring to bear. But we're also really aware that there's a whole lot of stuff going on out there that you all are figuring out. And today, this week's special topic, our peer support session, is going to be focusing on hotel vouchering as one of the strategies that programs around the country can use or are using already to respond to the COVID-19 pandemic. It's one of the ways that folks are trying to meet the challenges of sheltering folks, sometimes isolating folks if they're sick. There are a number of other ways that hotel vouchering is being used. And you all probably are part of a huge group of providers that already to some extent is using hotel vouchering to respond to emergency sheltering. Some programs use it when there are capacity issues and they can't accommodate a family that really needs to be housed quickly. Some folks use it as a regular part of the way that they do sheltering, and some folks maybe haven't done very much of it and are curious today about how they might get that started. So we learned from the field that there's some great stuff going on in the state of Iowa around hoteling during the pandemic. And we've got some experts from Iowa, and they're going to be introducing themselves. You can see them on the front, the opening slide of today's presentation. And we're not going to be very slide heavy today. We're really hoping to be very conversational and hope that we can find ways for you to join in. We were hoping that we could unmute folks so that we could hear your voices. We'll see how that goes, but we're not so sure if that's going to work in this Zoom platform. But we are definitely going to be watching the chat. You should all know and can see probably that you're muted. Everyone's muted. And we do want you to know that we're going to be recording this session. There are a whole lot of people that signed up for this session. Some may not be able to come. Some may want to listen to it later. So we are going to be recording the session. We want you to really put your questions, it's a strong invitation to put your questions in the chat box. We'll hear from our presenters first, and then we'll open up the dialogue. We've also got Jill Robertson from Collaborative Solutions and Debbie Fox from the National Network to End Domestic Violence. Both organizations are also part of the consortium, the Domestic Violence and Housing TA Consortium, and they'll be here to help with questions as well. When you put your questions in the chat, if you would please use all panelists and all attendees so that we can see them and pull them out and share your wisdom, your challenges, your questions, and so forth. Okay, Jenny, I think we can advance the slide. Here's just a little bit more about the Domestic Violence and Housing TA Consortium. Many of you have had connection with us in one way or another, or have had connection with one of the technical assistance providers that you see on your screen. It's a real unprecedented partnership of federal partners and national technical assistance providers so that we can work collaboratively even in ordinary times, to respond to needs of communities around the country who are looking at the intersection between domestic and sexual violence and housing and homelessness. So that's who we are. And I see a question already about whether we'll be sharing the slides. Yes. There's not, as I said, going to be a whole lot of information on the slides themselves because we've got the experts who are going to be telling the story. So I think the recording will be really helpful for you to tap into afterwards. So I am going to step back from the mic and turn it over to our first person from a program in Iowa, Ashley Odom. Ashley?
All right, thank you, and hello, everybody. I am with Family Resources, which is a nonprofit organization, and what I do specifically is I am the Director of Survivor Services. So I oversee our domestic violence, sexual assault, human trafficking, homicide, and other violent crimes programs, as well as our sheltering and housing programs. We serve 5 counties in Iowa and 3 counties in Illinois. So we are a bi-state program, which is always fun and interesting. But in regards to hotels, we have used hotels as a form of sheltering for the past few years. So using hotels is not something new for us. Just the capacity that we are using them is newer for us. And in response to the COVID-19, what we really did was we put together a policy that really laid out 3 different phases to know when we were able to, or when we were going to transition from having our 54-bed shelter in the physical bricks and mortar building to moving to hotels for all survivors. So our first phase was the preparedness and prevention phase. And so we still operated within our bricks and mortar shelter with the 54 survivors. And we just kind of were waiting to see what was going to be happening in Iowa to see if we needed to start moving survivors to hotels. But our phase 1 was pretty much operating as is. And then our phase 2 was the mitigating community transmission. And so during phase 2, when we were assessing the lethality of survivors who were calling to get into shelter, what we would do is really see if they have any medical issues or are at greater risk. And those who identified being at greater risk, we would place in hotels, or those survivors who said that they didn't feel comfortable in the physical bricks and mortar shelter, we would also place in hotels. So we had about half of the shelter full with survivors, and then we also used some hotels for survivors. And then we finally moved into phase 3 of our plan mid-March, and that was the harm reduction. So we made the decision to no longer utilize our bricks and mortar shelter and move everybody into hotels. And like I said, we already used hotels previously, but we really use this COVID-19 as a chance to really negotiate costs with different hotels, because hotels right now, they're not seeing the number of individuals utilizing them as what they were previous to this. And so we were able to negotiate rates. It took a couple days going back and forth with a couple different hotel chains. And then we finally found one that was the best price for us, and there was a bus route and everything like that. So it was accessible for survivors also. And so we decided that we were not going to place all the survivors in one hotel. We were going to separate it out into 2 different hotels. And what we ended up doing was getting a block of rooms at 2 different hotels. So there may be some nights where one of the rooms that our agency is paying for is not being utilized, but we know that we still have beds available in the hotels to use. So because we did initially run into the issue of one of the hotels that we were previously using got booked because one of the homeless programs in the area, one of the shelters, moved all of their clients into that hotel. So we wanted to ensure that we would not need to be moving survivors from hotel to hotel, which is why we booked a block of rooms at 2 different hotels. We also are making sure that we're getting billed weekly, so then we can kind of keep track and make sure that we're getting billed correctly and that we can just stay up to date with the invoices and everything also. We also have done a lot of negotiating with Salvation Army and working with other providers in the area. So our local Salvation Army is actually delivering meals to the survivors at the hotel. So they will drive their van up to the hotels, and any survivors that are interested in warm dinners will go out. They know what time to go outside the hotel to pick them up. And then for breakfast and lunches, what we're doing is providing them boxed meals. and they do have refrigerators and microwaves in each of their rooms, so they are able to cook that way also. And then one of the things that we found out that we needed to do was figure out how we could get laundry done. And so we started giving vouchers for the laundry rooms at the hotels in order for them to be able to wash their clothes while they're there, because that wasn't something we initially thought of when we made that transition. And then we have 2 services coordinators within our program, and they go to the hotels daily to meet with the survivors. And that's really based on what the survivors are saying that they wanted, because they liked having that contact with somebody every day besides just being in their hotel room, just themselves or themselves and their children. So our services coordinators go every day just to meet with them, really focus on quickly transitioning them out of the hotels into their own housing. And then we've been assisting with rapid rehousing dollars as well. And so our services coordinators do have spots at each of the hotels in conference rooms where they can make sure that they're social distancing, but still being able to meet face-to-face with the survivors and providing that ongoing support for them. And then if there are some survivors that just don't want to meet daily, that is definitely fine too. But like I said, we've been really seeing that the survivors are really requesting that we go every single day to meet them. And I think that's pretty much the overview of how we are providing shelter through hotels.
Okay, thank you so much. And we're going to move along and hear from Kelley and Jodie. I'm sure, Ashley, people are going to have tons of questions about what you described. So we'll come back to you after we hear from Kelley and Jodie. Thank you.
So, hello, everybody. I'm Kelley Schmitz. I'm the Operations Director for Friends of the Family. Just to give you a little bit of background on our organization, we serve 20 counties in Northeast Iowa, 14 of those counties of which we're providing victim services, shelter, and housing to. Aside from that, we also do provide housing services for homeless individuals and families, as well as comprehensive human trafficking services. Our victim service, shelter, and housing program has actually, in the past maybe 5 years, taken a larger focus on safe housing and tried to not completely move away from shelter. Obviously, that is a need for people, but really trying to figure out how do we create permanent solutions for survivors of violence who need that housing piece. And so what we did was we took our victim service, shelter, and housing program and actually split it into 2 teams that are operating under kind of the same grant funding. And it's a team of advocates that have a shelter focus, as well as a separate team that is working housing specialists that are actually working outside of the shelter, so more in an outreach remote capacity. Jodie's actually going to talk to you more about our current shelter and hotel vouchering response during the pandemic. But we've been utilizing hotels throughout the 14 county service area as part of our emergency response since about 2013. So this is not something that's completely new to us. And so I'm just here to help answer any questions about how we operate, but I'll turn it over to Jodie now.
Thanks, Kelley. So this is Jodie Schmidt. I am the Shelter Services Manager with Friends of the Family. And so as Kelley had kind of mentioned, we had utilized hotel options in the past, just as our bricks and mortar shelter would reach capacity, and we would be identifying individuals that need safety that night. We would utilize those hotels. And so in response to COVID, we had heard kind of from Ashley and what they were doing with their response, and she was very kind in sharing kind of their phases and what they had marked out. And so we kind of based off of that what our response looked like as well. And so initially we bolstered our kind of supplies and cleaning, and then also what our awareness looked like with staff, and also making sure that clients in our shelter were kind of up to date and aware of everything that was going on. Initially, we did ask for a voluntary identification of anyone in our shelter that was having symptoms, and we did have a few people come forward, and we were able to then move them to hotels. At that point, we didn't know if it was COVID or if it was just some other virus, but we felt it important to get anyone that was self-identifying some symptoms moved so where they could be more isolated. With that being said, our shelter is a communal living shelter. It's a 21-bed shelter, so people are sharing bedrooms with one another, which kind of led us to that decision of being able to have people more isolated. We also did ask for anyone that wanted to self-identify any conditions that would maybe put them at higher risk to get COVID or have worse symptoms of it. And we did have like one individual come forward, so we were able to get her initially moved into a hotel as well. And then at that same time, we just bolstered reaching out to our hotels, having more conversations, knowing that we were probably going to be moving forward with utilizing them more. We already had MOUs in place with hotels. We already had, I guess, a foundation built with them. We also started looking at what hotels have we worked with that have more accommodations and more willing to work with us and our clients. We looked at hotels that had like the laundry available. We're still offering some sort of breakfast, had more available in the rooms as far as a kitchenette. We were able to find and work really closely with an extended stay hotel, which the room has like a little stovetop and everything in it, and stuff like that. So then as we kind of moved, this would have been about mid-March, then we made the decision to close down our offices and have all of our staff working remotely. We do still continue to have shelter staff posted in our shelter and to answer our 24/7 crisis line, but also we made the decision not to completely move everybody out of our shelter. So our shelter, we have 2 full bathrooms, and so we made the decision that we could still have 2 unrelated households in our physical shelter building, in different bedrooms, utilizing different bathrooms, taking turns sharing that kitchen or communal space. But we felt that we would be able to safely still be able to keep 1 to 2 unrelated households in our shelter building. And then everyone else was moved into hotels. And then we also, again, upped those conversations. I ended up having daily conversations with our hotels, came to be like first name basis with managers as we built those relationships. A lot of the conversation did surround like rates. We did not opt to do the like block of rooms. We did not have the issue of not being able to access hotel rooms. Hotels in our area are pretty cleared out, so that wasn't an issue for us. It was more, what can we do for each other? The hotels were definitely ready to jump on board with whatever we needed. And so we just continued really heavily with those conversations with the hotels. And then our third phase kind of hit the end of March, beginning of April, where we, sorry, I kind of jumped ahead a little bit. Initially, prior to the end of March, we limited shelter occupancy to 10 or less. And then it was towards the end of March that we decided to move towards having the 2 unrelated households. So since then, we've just had 2 individuals in shelter. And then as we've worked more with hotels, we're doing more mobile advocacy. Our advocates are not going to hotels daily or anything like that. We're checking in with them on first shift and second shift via phone. And then things that we might need done, like maybe a signed release of information or any kind of paperwork stuff, the hotels have been more than accommodating. They're letting us email them things, they're printing it off and putting it, in the person's, by the person's door or something like that. So hotels have been super fantastic with kind of almost co-advocating with us, with clients. We also have had agencies or other people in the community stepping up, asking how they can volunteer. So they're providing maybe some meals to the rooms or things like that. And then utilizing like the local food pantries to put together some boxes to take over for our shelter clients. We also, about mid-March, brought on, Kelley kind of talked about how we split, where we have our shelter response and then we have our survivor outreach housing focus, and we brought those two kind of real close back together to collaborate. So anytime we're putting a client in a hotel, they're getting kind of that shelter advocate response, but they're also getting that housing advocate response right away, and those two are co-advocating together with that client to really aggressively move that client from hotel onto either a diversion or a permanent housing solution. So I probably missed a lot of my points, but I want to kind of make sure you guys have time for questions. A few things that I just wrote down that as I kind of looked back on how we've done things, I think the main things that I thought of was, don't be afraid to ask questions of people, even if it's not their typical role or responsibility. I've asked the hotels for a lot these last few weeks, and they have stepped up to the plate every time. They've gone above and beyond. So I just don't ever be afraid to ask somebody, I guess would be my number one thing. And then also like communicate. The more we have communicated and kind of gotten on this daily routine of talking to the hotel managers, to the point of like, we're texting and we're first name basis, obviously nothing confidential, but just checking in with each other even, has made that so much easier and smoother for clients as well. So I think that's about all I have.
Okay, thanks, Kelley and Jodie. Let's move over and see what we want to hear from Zeb.
Awesome. Great. Thanks, Chris. My name is Beilke-McCallum, and I am the Director of Housing and Economic Justice at the Iowa Coalition Against Domestic Violence. We are the state coalition for both Friends of the Family and Family Resources. And the only part to this that I will add is sort of the framing work of this is way back in 2013, the coalition, along with our partners, decided to make a shift around how we deliver domestic violence services that kind of deprioritize shelter and looking at a more holistic approach to domestic violence services and what survivors were telling us that they needed. And we've been pursuing that transition since 2013. And I really think that was what set up the ability of Family Resources and Friends of the Family to be able to make this shift so quickly when COVID-19 hit and take on all of these challenges that folks are talking about, and address the questions that I'm seeing come up in the chat, because these are all questions that we've been pondering about for a while. So I want to get to those questions and allow Kelley and Jodie and Ashley to address them.
Okay, thanks, Zeb. Yeah, and I think one of the themes that I heard is that some of these pieces have been in place for some time, and so there was kind of a foundation on which to build, which is really different than some communities find themselves in the position of, you know, not using motels or hotels very much, and so trying to build the relationships right now. So these programs did have that advantage of already having those partnerships in the community. So thanks for that background. I know here in Portland, Oregon, we've had a robust hotel vouchering program as a form of emergency shelter for quite some time. And it's definitely something that's very great to have in place right now. Some communities are actually devoting an entire hotel to survivors or finding other ways, as have been mentioned, blocks of rooms, or scattered site use of different motels. But having that relationship in place is sounds like has been pretty key for the folks that we've been hearing from Iowa. I'll just get us started with some of the questions that I've seen in the chat box, and I'm wanting to invite Debbie and Jill to bring some forward as well, because I think you've been watching too. Lots of questions, Ashley and Kelley and Jodie, about funding. Surprise, surprise. How are you funding the hotel use, and what does that look like in terms of the mechanics of, you know, getting folks to the motels? And let's just look at funding first, because then we can take on confidentiality. So starting with funding.
So
can you tell?
This is Ashley, and we are using a lot of different funding sources to pay for hotels. So we are using some of our Crime Victims Assistance Division through the Iowa Attorney General's office to pay for some of the hotels. We've used those funds previously before COVID-19 to pay for those as well. A lot of different like Community Foundation and United Ways and stuff have started doing fundraisers to raise money to help provide agencies like us dollars to cover the cost of hotels and cover the extra costs that go into that. And so we've just been really trying to apply for funds locally and at the state level, and even if there's any federal funds that we see. We've been having discussions about the ESG dollars that should be coming, and we will look at trying to utilize some of those as well. We are also working really closely with our city and counties and having a weekly phone call with them. So I'm on it, and then 2 other homeless service providers in the community that provide shelter are on that as well. And so they have been looking at accessing the FEMA dollars that then will come back to us also. We also have done a social media fundraiser, because our largest fundraiser that was set to take place in April was canceled. And so we did a social media push and really said, if you give $500, this is how many nights it would cover for a survivor in a hotel. If you give $100, this is what it would cover. And so people were really willing to donate, and we reached our goal in less than a month of what we were kind of asking the community to provide. So we've really tried pulling all different resources together. And I think negotiating was a huge thing. Trying to negotiate with the hotels definitely was beneficial as well. And like I said, I know we have been using hotels for quite a while now, but the hotels that we're actually using now are new relationships that we did not have prior to COVID-19. So they were definitely willing to help as well and give kind of reduced costs, but we are pulling all different funding sources together to cover this.
And Ashley, this is can you talk about just what a tough negotiator you were, and the coming down to few dollars and walking away from a hotel?
Yes, so I was going back and forth with a few different hotel chains. There was one that was offering either $6 or $8 less than the other hotel, and so I went back to the other hotel chain and said, listen, they're offering, I don't remember now if it was $6 or $8 less. Can you guys offer less than that, and we can book a block of rooms? And they just said, sorry, we're not able to. And so just negotiating and utilizing kind of the hotels who were willing to work with us, we were able to really negotiate lower and lower costs, which definitely helped. And they were a lot lower than what we were expecting.
I want your help when I buy my next car. Any additional comments about funding? It sounds like a variety of different sources have been used. ESG funds can be used in some circumstances, and lots of help from the community, it sounds like, your local United Way. Anything else that hasn't been mentioned? Because lots of questions about funding.
This is Kelley. I think Ashley covered it really well with, we are accessing all of the same types of available or potentially available pots of money. I think one of the things that has been really important with negotiating, also on the landlord side, we've had some conversations with some landlords that we've developed great relationships with that have either been willing to temporarily waive a deposit fee to get somebody into housing, or just provide some flexibility so that we can move people through. We've been very fortunate to see lower lengths of stay than we originally kind of thought we were looking at when we started this process during the pandemic. People have come out of a hotel shelter response within, sometimes it's a matter of just a couple of days, whether that is going into a permanent housing placement or being able to work on the diversion side to get them placed somewhere else while we can work with housing. So that's just another way that we're kind of working on stretching and using some flexibility with dollars.
Moving people through so you can house new folks in those units. Yeah. Okay, that's great. And I do think there were lots of questions about confidentiality and safety, and I'm hoping that you all can address that to let us know what you're doing around things like releases of information with the hotels and motels, if they're handling client forms and putting them in specific individuals' boxes, that reveals some private information. How do you get folks into the hotels in the first place? Do you have to furnish names? Just anything you can tell us about how all that is working, and how you ensure, to the best of your ability, that the hotels are safe placements for folks.
Yeah, so this is Jodie with Friends of the Family. So initially when we start to work with hotels, like I said, we do have memorandum of understandings already in place with hotels. So we have that kind of covers confidentiality. And then when we book people in hotels, or when I guess we reserve rooms, we do not share any client data or information other than like size of household. So we book it under kind of an alias. So it might be Jane Doe, it might be, sometimes it's me or Kelley because it's our names on the credit cards, or it's just Friends of the Family. We have luckily not ever had any issues with like any type of breach of confidentiality. As I said, like the hotels have always been really well and have even upped their game with working with clients. When we're sending information, so like if we're emailing a release of information, we're not filling that out prior. They're just getting our blank, release of information and then handing it to the client. So again, like they're not seeing necessarily names or anything like that. And then we're talking with the client as far as like how they're comfortable with maybe getting some of that paperwork back to us. Either we're having staff stop by and pick it up, or maybe they're snapping a picture of it filled out on their phone and emailing it. I don't know that any of them have had the hotel like get it back to us, but it's a good way for us to get like the blank documents to them to fill out and then to kind of get back. And then as Kelley kind of mentioned with landlords, specifically, we've also been able to work with some landlords who have been more willing to do things more remotely. And so we might have a staff go look at the place, take pictures or video, and then show, send it to the client, and then doing things without, everybody in the same room at the same time, even signing a lease remotely and then getting it back to the landlord and things like that has been very helpful in getting people moved through quickly. And I don't know, I think I saw a question about security wise, like we don't have staff there. And like I said, they're not even going to meet with clients. They're really working remotely and over the phone or video chat. And in our MOU, it kind of talks about safety and security. So if there was a concern that the hotel had, they would be calling us in regards to something that was going on, so that we could then advocate with that client about what is kind of going on, if that answers that question.
Mm-hmm.
This is
Okay.
actually, and in regards to the safety piece, what we always say is survivors know best what is safe for them. And so if they feel like they are not safe at one of the hotels for whatever reasons, we will explore alternatives to looking at other hotels, or, you know, if we can just immediately get them into some type of housing, or, you know, as their family or friends, really try to do the diversion piece as well. But really what we always say is survivors know what's best and what's safest for them. And so we really go off of what they say in regards to safety. And we also use different aliases. Every single survivor that we place in a hotel all has the last name. So we know on the billing that if there's somebody with a different last name than what we give everybody, that it's not our client and we should not be billed for it.
Okay.
And then we also we don't have hotels do anything with any of our paperwork, since we do still have the services coordinators going into the hotels daily. So there is no passing of any documents or, you know, emailing anything to the hotel staff. We really learned, and we kind of changed what we were doing. So we don't tell hotels that that we're sheltering specific survivors. So we don't tell them that we are sheltering survivors of domestic violence, sexual assault, human trafficking, and other violent crimes, because what we had learned a couple years back is the hotel staff really then thought that they should treat the survivors different than the rest of their guests at the hotel. And so what we've really been doing is just saying, hey, we're this nonprofit agency. We provide more than survivor services. And so it's a little easier for us to say, you know, it's just we're working with from family resources. So we don't even say anything about domestic violence or sexual assault, because we've really run into the issues of hotel staff trying to treat survivors differently than any other hotel guest.
Yeah, I can definitely echo that from my own experience. Using motel vouchers here in Portland would sometimes have overly solicitous hotel staff who are maybe just a little bit too involved in what that participant was doing, who they might be visited by, that kind of thing. So trying to keep that very professional and revealer of private information in whatever creative ways you can is really important. And then that sometimes feeds into decisions about which hotels to use and which ones to stay away from if you have experiences that they're not going to work with you well. There have been some questions about damage to the hotel rooms, what happens if that occurs. Also, whether survivors are found by their abusers while they're at the hotel and what might transpire in that situation. You already said that somebody might be moved if they're starting to feel unsafe. Anything additional that you can share with other programs about those safety concerns?
Sure, this is Ashley. We definitely have had instances where there has been damage to hotel rooms. And so what we do is we just cover the cost. Typically they charge $150 is what we've been charged in the past by hotels. And there was recently damage to one of the rooms as well. And what they do is just send us some pictures of what it is, and then we just cover those costs because we don't want to ruin the relationships with the hotels. And kind of one of the biggest things that kind of has always been an issue with the hotels is the smoking in the rooms. And so sometimes we do get charged because there was smoking in the room. And so we just pay that cost.
Yeah, this is Jodie with Friends of the Family. And as far as like damages to rooms, smoking, those kind of things, we're right there with Ashley and her team. We just go ahead and pay that cost because we want to make sure that we're keeping those relationships with the hotels. And there's times that hotels also know and support what we do. So they might like charge us half of what they typically would for like a smoking in the room charge or something like that. We get a lot of really great feedback and partnerships with the hotels that we have been working with. And then, you know, to speak to the point about, well, if the abuser finds the person, that's definitely happened in our time here. And, you know, initially we want to make sure that everyone's safe. And then we are able to talk to that client and find out what they want, and if they want to be moved to a different hotel or maybe even relocated to a different city. We have 14 counties that our shelter serves, and so we worked hard to get an MOU in place with a hotel in every single county that we serve. And then some of our larger counties, we have multiple hotels that we have MOUs in place with and work with. So we have kind of a pool of hotels to kind of offer and pick from. So that definitely helps.
Great. Okay. We had some questions about what other services could be available to people in hotels, and that might be different during the pandemic than it might be during ordinary times. But there were some questions in addition to the virtual advocacy and the visits that Family Resources does to the folks that they place in hotels. Are there services available along the lines of counseling, anything for children? People had some questions about how you might reach to help meet those needs when folks are sheltered through motels or hotels.
Right. So at Family Resources, we hold contracts for not only sheltering and housing, but for our domestic violence, sexual assault, human trafficking, and homicide and other violent crime programs. And so in those programs, we do have therapists and counselors. And so if the survivors in the hotel are wanting counseling or therapy, we will connect them with one of our counselors or therapists, and they will do that over the phone or some type of like FaceTime and stuff like that. So they are doing everything that way right now. And then I know a lot of nonprofits in our area are still open. They're just providing services differently. And so a lot of the time right now it's looking different, but we still are trying to connect the survivor with other resources in the area, kind of based on what they want. And also within our programs, we have youth advocates. And so our youth advocates can work closely with the children, especially now with schools being closed and everything. Our youth advocates have been busy kind of printing off different work and different activities and bringing them board games and different things like that that can keep them occupied and busy. That has been helpful as well. So we still try to provide whatever services we typically would within the bricks and mortar shelter. We try to provide those same exact services within the hotels. It's just may look differently, especially now because of COVID-19.
Right. Okay, great, thank you. I did notice a comment in the chat that it would be important to mention that hoteling is not a new strategy. And I'll just really echo that this has been, and thanks for raising that. This is a strategy that programs have been using, all kinds of social service programs for a very, very long time. And so it may be new to some folks who are just now reaching to it as a strategy during COVID-19 response, but it's been in place for a very long time in many communities. So thanks for helping us make that point. A question about how long do people typically stay in the hotels? And I think Iowa may have a different affordable housing situation than many communities have, because you've talked about being able to move people pretty smoothly into housing from the hotels. So anything you can tell us about length of stay, how you make that connection into housing? Do you work through your local COC? You have mentioned relationships with landlords, which is really key, but anything that you can tell us about the affordable housing situation there that helps us understand how you make that smooth transition for folks who are in hotels. It's a big challenge in many communities.
Yeah, I think it's definitely still a challenge here. We have a landlord network, so we have a pool of landlords that we work with, and landlords even more so now are willing to really help get survivors transition out of hotels into their own housing pretty quickly, because landlords know that we do have some funds available that can help with rapid rehousing. So they know, because they can't do any type of evictions right now, they know that if they are working with our program, that we will be able to pay at least a few months rent. And so that we've actually been able to really transition survivors from that sheltering option into housing a lot quicker. There's definitely a lack of affordable housing in our areas, but we just get really creative and continue trying to expand on our landlord network. Our public housing Section 8 voucher wait list is over 8 years. And so that's not really even an option for us right now or for survivors to access. We do help get them on the list if they've not been placed on the list yet. And then our low income housing properties in the area also have either waiting lists or waiting lists that are closed, so they can't even get on them. So it's just really, again, negotiating costs with landlords, because a lot of the times, especially the private landlords, they're a little bit more willing to negotiate, especially if we say, hey, we have volunteers that when this survivor moves out, our volunteers can come in and clean the unit, and then we can get somebody else to fill that unit. So really working with the landlords on trying to negotiate different rates.
And that's been a long time relationship cultivation that is coming in really handy now. I know that there are some communities where there's lots of money being put into hoteling during COVID, but it's a time-limited stay, and then what happens to folks when they have to leave the hotel? So it sounds like, again, having those relationships in place that you can just massage and develop further to be assistive during this time has been something that's come in very handy.
Definitely. And I would say we have had survivors that even before COVID-19 that have been in hotels for about 30 days just because of the amount of barriers that are in place. But typically for hotels, the stay is about 2 weeks from the time they come in to when we assist them in transitioning out into whatever housing they may want. Wow,
that's amazing. And that's great because hotel rooms are not an ideal place, especially for families with lots of kids. So awesome. I did see one note from somebody who lives on one of the Hawaiian Islands that all the hotels there, with maybe 1 or 2 exceptions, are closed right now. And so they're not an option, which is really a shame because many communities are finding them to be, it's kind of a win-win situation where the hotels benefit from having their rooms filled, and the programs benefit from having places to safely house people. Okay, let's see, a question about how do you feel about the survivor having guests when they're in their hotel room?
So I can talk about what we do with Friends of the Family. When we are kind of initially setting up and having that conversation with the survivor seeking shelter, we, as part of our MOU with hotels, there are specific things that we go over with the client on the phone prior to them entering the hotel. It's kind of a few things of, do you agree not to smoke in the room, which doesn't always happen, but we ask it anyways. One of the expectations is that they allow housekeeping in daily, and that is so they can continue to keep the room clean. And then also if something were to be damaged, that would be something that we would know more ahead of time versus, finding out 2 weeks later. So housekeeping that's an expectation that they allow them in every day to kind of do their cleaning and all that stuff. And then the way we operate it is you can't have anybody that's unauthorized in your hotel rooms. So the people that you have initially kind of said that's going to be seeking shelter with you, that does not have to necessarily be a relation. It's whoever you kind of identify as your quote unquote family or whoever's seeking shelter with you. And then there has been cases where maybe they have a child who doesn't live with them all the time and they're going to come visit. That's just a communication piece. Communicate with your advocate so we can let the hotel know that you're going to have an additional person there for a little while or whatever the case may be. And so that's kind of how we operate it. If we find out that they have people staying there that weren't kind of authorized or that we knew about, then that's a conversation that we have with the client, because we want to make sure that we are, you know, being fiscally responsible with our funding and resources that we have, and making sure that the people in there are getting the services that they need as well. So it's about those conversations with us, and then also, again, we want to keep that relationship with the hotel. And if somebody's in there and having all these people in and out, we found it that when we let the hotel know, hey, they have a kiddo, it's not going to be there all the time, but they are going to be visiting, so you might see some more people in and out. That's really helped with that relationship with the hotels.
So they don't have to be suspicious about who that visitor is and so forth. Yeah.
Yeah, and we don't want
see it
to, yeah, we don't have somebody like monitoring 24/7, right? Like the hotel isn't necessarily keeping track of every person that, you know, potentially would be coming in and out of a hotel room or anything like that. It's just more of the, that survivor's there, they're an adult, they know the expectations. If they need something, or, you know, we don't want it to be where like we're in major control of that hotel room either, if that makes sense.
Yeah. Okay. I did see a note in the chat that some communities, when hotels are not options, or maybe even where they are trying to form relationships with places like retreat centers. Some communities are using college dormitories that are shut down because all the students have gone home during the pandemic. So it's unfortunate if hotels are not a resource in your community, but there are some creative ideas that people are offering in the chat about other options. One that's been mentioned is Airbnb. And that could be, maybe that's not the case in Hawaii from the one commenter who talked about the Hawaiian Islands, but Airbnb is potentially an option that people are exploring as well. We had several questions, so I want to ask all the panelists, and I want to ask everyone who's talked about their practices around hoteling in the chat box today. We would be so graced by your willingness to share policies. And I think sharing policies with one another among folks who have attended today, as well as sharing them with us at the consortium so that we can have them available to people who are looking to not invent the wheel if they can help it. So things that have to do with the MOUs that you might be forming with the hotels and motels. People would really like to get a look at those so that they can see what aspects should be included. And in general, just best practices around hoteling would be something we really invite all of you to contribute to if you have those in writing. A lot of this work is being done on the fly, but we're definitely having to keep a paper trail, maybe not paper, electronic trail, so that we can have some practices that we can work from and train staff around and so forth. So anything around policies, examples of MOUs, et cetera, would be extremely helpful for you all to circulate with us and with one another. Let's see.
I thought of something else I could throw out there. I don't know if this has actually been asked, but this is Jodie again with Friends of the Family. Our shelter, we allow pets, obviously service animals 100%, emotional support or pets. We try to also accommodate when we can. Now, sometimes there are severe allergies or things that we also have a like fostering program that we got a grant through Red Rover. And then I'm not sure what other funding Kelley might know, but to be able to board and then foster a little bit longer term for survivors. But we've also been having those conversations with hotels. And again, that was initially one of my questions with hotels was, do you allow pets and what does that look like? So that we could ensure survivors with pets were able to bring them with and have them safe as well with them. And then we pay like the pet fee for the hotel, just like we would, a cleaning fee, or if they're using the phone and have a long distance charge, we've authorized like those kind of things as well.
Okay, and so it sounds like you've got some flexible funds that you can apply to many of these uses. So that's another thing people are curious about, how they can develop in their own programs. And you've given lots of ideas, including, it sounds like, a lot of community support, people who are willing to bring meals and be liaisons between your program and some of those resources. Have definitely been something that has stretched your capacity to serve this. And I think one of the points that we want to make today, because we're getting close to the end of our time, is that I think we've had some great examples in the form of these Iowa programs today of victim services programs that have developed hotel and motel vouchering as part of their regular operations, as part of what helps them meet the need in their community. And so it doesn't have to just be an add-on that we ramp up during a crisis or during a pandemic. It can be something that is one of the tools or strategies that we have to rely on even in ordinary times. So we're really wanting to hear from programs who have had experiences with hotel and motel vouchering during the pandemic, and how you're reflecting back on implementing those strategies in terms of whether that's something that you might be continuing to do as part of offering a range of options, which is part of best practice in our field. So I think we've got just a couple of minutes left. Debbie or Jill, are there any questions that I have missed in the chat that you have hung on to?
Hi, everybody. This is Debbie. Thanks, Chris. I think everything has been covered. I just want to thank everyone for being on the call and all the great questions. And I just am so heartened to hear all the responses in the field. And if anybody has funding specific questions, we have a little cheat sheet on the Safe Housing Partnerships website around all the new federal resources that do cover housing as it relates to hotel and motel sheltering. So I'm happy to be a resource for that. Thank you.
Thanks, Debbie. Anything from you, Jill?
Thanks, Chris. Yes, I just wanted to say thank you as well to our panelists today and for sharing such great information around hotel, motel vouchering and opportunities. And just wanted to remind everybody on the call, many of you already receive ESG funding through HUD, but HUD is releasing a tremendous amount of money. So please make sure you work with your COC, your state, and your jurisdictions so that you can receive some of that funding to help you with the hotel, motel needs and just other needs that come up as a result of this pandemic.
Great, thank you, Jill. And I want to say a final real hearty thanks to Ashley, Kelley, Jodie, and Zeb for sharing your experiences and how you're meeting the challenges of what we're facing in today's world, and how you've been doing it on an ordinary basis as well. I think it's been really helpful, great conversation. And I do just want to say, as somebody who's not actually in the weeds with a program, operating a program right now, or as an advocate out in the field, that you're our heroes. We really appreciate everything that you're doing to help survivors during this extremely difficult time, and to make it really clear that when we tell survivors you're not alone, we mean even now. So all the ways that you all are figuring things out and hopefully taking care of yourselves and staying safe yourselves and not taking undue risks, but being there for survivors, it's just impressing me and those of us at the consortium every single day when we hear your stories. So thank you. You're part of who we cheer for at 7 o'clock every night when we thank the healthcare workers. It's not just the healthcare workers. And thanks from the bottom of our hearts. Okay. Thanks, everybody. Take care. Stay safe.